If you or a loved one is approaching retirement and are looking for a caring community to answer your questions, you are in the right place this morning on KFOR. Every Saturday morning, we offer you the Aging Adventure, brought to you by Legacy Retirement Communities. I'm Dale Johnson, joined by John Kopetsky, Executive Director of Legacy Terrace at 5700 Fremont Street, and Kathy Blythe, longtime radio host here on KFOR and longtime advocate for Lincoln seniors. Good morning, Kathy. Good morning, John.
Hi, Dale.
Good morning, Dale.
Kathy, John, and I are all experiencing the joys of grandparenting. Some people 55 and older, though, don't have that opportunity. For them, the Foster Grandparent Program provides a way to stay active by serving children and youth in their communities. Sam Bates joins us later in the show to talk about it. Sam is Community Engagement and Partnerships Specialist at the Community Action Foster Grandparent Program. That's ahead on the Aging Adventure. Right now, John and Kathy discuss hospice care with Dr. Bob Bleicher of HoriSun Hospice.
Hospice is something we've probably all heard of, but there are so many misconceptions out there about what hospice is and what it isn't. So let's start with that.
Hospice is a free benefit that was created by Medicare back in 1982 to care for patients who are at the end of life. Hospice really has a naming problem because many folks think that you have to be dying to be a hospice patient. But really, hospice is not about dying. Hospice is about living as long as you can with whatever troubles you. So even though Medicare guidelines recommend we select patients who have a life expectancy of less than 6 months, the truth is that nobody really can tell when their life is close to the end. But it's super important to remember that hospice improves not only the quality, but also the quantity of life for the patient and the caregivers who are going through that same journey. It's important to realize hospice is not about hastening death. I've had so many people accuse me of just drugging people until they stop breathing. But in fact, folks utilizing hospice at the end of their life live on the average 22 days longer than those who elect not to use hospice services.
One of the important things regarding hospice is continuing medications. Let's say you're under care for a given condition. Does going on hospice mean you're no longer going to treat those conditions? How does that work out?
It's an important question. Hospices generally do not stop medications. You have to understand that it's in the interest of the hospice company to have that person continue to be as healthy as possible. So most of the time, we will not stop critical medications.
Dr. Bleicher, can you touch on some of the reasons why a person might choose hospice and then what the defining factors are?
Medicare has set out guidelines for when patients should enter hospice. The best thing to do if you have decided that more trips to the hospital, more aggressive treatments, that sort of thing are really not improving how things are going, is to ask one of the hospice companies in town to come and talk to your family in your home, and see if you are eligible for admission or if you'll need to wait a while.
So can you give us a 30,000 foot, I guess, overview on what services are included and how is it different if you're in a hospice facility versus hospice in your home?
Hospice provides an amazing array of services to patients that include nursing visits, nurses' aides who perform bathing and personal cares, light housekeeping, the medications we've talked about a little bit, durable medical equipment, oxygen, hospital beds, wheelchairs, walkers, bath and shower chairs, CPAP or BiPAP if you're on those devices. All that's included, plus chaplain or spiritual care services, social work, and volunteer services. And all of these services are provided wherever you call home. And to answer your question about hospice facilities, there really should be no difference in the care, whether you live in a facility or in a home or wherever. Most folks simply carry on with their lives as best as they're able with the help of hospice services. Now, there are a handful of folks who simply lack caregivers or family or spouses to do many of the duties that are required for somebody who's at end of life. By that, I'm talking about bathing, turning, medicating and feeding, things like that. And so those folks sometimes will end up in a hospice facility. There's two in the Lincoln area. One is the Journey House around 48th and Randolph Street, and the other one is the Monarch at about 76th and Pioneers. There's only about 18 beds total between the two facilities, and oftentimes it's hard to get in, but they are very useful for people who lack caregivers. The problem with those facilities is that they are private pay. They provide superb services at the end of life, but most folks elect to stay in their homes as long as they can, and they'll hire private caregivers if needed when care needs exceed those that family and friends can provide. Most folks are pretty amazed at all the benefits and loving care that they can get from hospice, including that bereavement service, which is really important for about a year after someone has passed. Now, it's also important to realize that hospice does not pay for room and board, except in rare cases in people who have Medicaid benefits or some who have long-term insurance policies that cover that.
We'll certainly be wanting to continue this conversation with Dr. Bob Bleicher of HoriSun Hospice. We'll be back with more on the aging adventure in just a little bit.
Thanks for staying with us on the Aging Adventure, brought to you by Legacy Retirement Communities. I'm Dale Johnson with John and Kathy and Dr. Bob Bleicher of HoriSun Hospice.
Dr. Bleicher, let's talk a little bit about what to do as far as dealing with terminal illness in your family and having this conversation about hospice care. Do you have sort of a roadmap to get there?
I would say that for those who are dealing with terminal illness, it's important to have the hospice talk much earlier in the course of disease, if at all possible. A lot of these diseases don't have a known endpoint, but when folks feel like the treatments aren't working well and they just don't feel that good and they don't want to go back to the hospital, it's important to talk about hospice as an option. Earlier is always best because it takes a while for hospice personnel to get to know their patients and do the best. There is a form called Physician's Orders for Life-Sustaining Treatment that should be on your chart at your physician's office, and people ought to start talking about what their wishes are for end of life, maybe as early as their late 50s.
So once a decision is made to go on hospice, is that permanent or is it revocable?
Good question. The decision to be a hospice patient is never written in stone. Many patients decide to revert back to their regular medical care, or as often happens, hospice manages them so well that they're able to leave hospice and then come back into hospice once their disease process has progressed and is further down the road. Another example, if somebody falls down at home and breaks a hip, they would revoke hospice, go into the hospital, get it fixed, and then re-enter hospice when they come home. And another example is some patients even want to change hospices. So again, it's pretty flexible.
We're learning so much from you today, and we really appreciate it, Dr. Bleicher. There are lots of resources out there for people who need more information. And we also should mention that hospice work is angel work. There's no doubt about it. And you've got a lot of angels on your team. Can you always use more volunteers? And tell us about the resources, too.
You bet. There's we hire volunteers to work to help people basically as someone to sit with a patient while the main caregiver, usually a spouse or other family member, takes a break. So volunteers are an important part of our treatment regimen. In fact, Medicare requires that at least 5% of hospice services be provided by volunteers. So they're a wonderful group. They provide music therapy, pet therapy, a lot of really great benefits for folks. So volunteers are dear to us. If you want more information about hospice, there's a lot of information out there. The National Hospice and Palliative Care Organization and the Nebraska Hospice and Palliative Care Association both have a lot of information. There are 8 hospices that serve the Lincoln area. They all have a website. If you just Google hospice services in Lincoln, Nebraska, so you can find them all. There's also a great Medicare resource called Medicare Compare that shows you the quality data for the different groups and how they perform. So a lot of people let that guide them in terms of selecting a hospice for their loved one.
Where would someone go if they're interested in being one of those angel caregivers and in volunteering in hospice?
All hospices are required to employ volunteers, and it's all volunteer work. There's no pay. So it just takes a call to a hospice. Then there's a training process, a background check, and all that, as you might imagine. And then those folks can go to work. With COVID, I think volunteers have been a little restricted, but that will hopefully be opening up in the near future.
Before we let you go today, is there anything that we've not covered? Obviously, this is a huge topic and such an important topic, but we've really appreciated your expertise. Anything you want to add in our last couple minutes?
A lot of folks ask me how hospice is paid for, and Medicare, Medicaid, and private insurers all pay for this. The patient and family incur no cost to be a hospice patient. In fact, it's a big load off of a lot of families because all of a sudden their medications and all their durable medical equipment, oxygen and what have you, are being paid for by the hospice. So it's a heck of a good deal. So the hospice is paid by those organizations for all the care delivered. And I would say for most people, you just can't beat the deal.
You know, we've had lots and lots of folks over my years here at the Legacy Retirement Communities who've been on hospice. We've had a handful, as you mentioned earlier, who have graduated off hospice for want of a better term, and went back to regular medical care. But I have seen so many families helped so much. And in fact, my own mother was a hospice patient for a period of time at the end of her life. And it was a difficult decision to make, to pull the trigger on that. But once it was made, it was a lot of comfort, particularly for her and also for the rest of the family. So thanks for the great work you do.
Thank you.
Thank you, Dr. Bleicher. Coming up, the joys of being a foster grandparent when the aging adventure continues. Brought to you by Legacy Retirement Communities. We're back on the Aging Adventure, brought to you by Legacy Retirement Communities. I'm Dale Johnson with John and Kathy. Volunteers who serve in a foster grandparent program provide the kind of comfort and love that sets a child on a path to a successful future. No one knows that more than Sam Bates, Community Engagement and Partnerships Specialist at the Community Action Foster Grandparent Program.
Before we get going, let's just start with what is Community Action? I know it's a big agency. Can you give us an overview of everything that goes on there?
Sure. So Community Action, our mission is to empower people living in poverty to reach economic stability. So we have 17 different programs that address the causes of and conditions of poverty in 4 specific impact areas. So those would be early childhood education, homelessness prevention, financial and family well-being, and hunger relief and healthy food access. So we cover a wide array of services in the Lancaster and Saunders counties communities.
Wow, those are a lot of services. And I suppose right now, many people are hearing about community action for the first time. Let's talk about specifically one of the arms of your program, which is foster grandparenting. And can you tell us about that and who's eligible?
Our Foster Grandparent Program is a partnership through AmeriCorps Seniors, where we have older adults placed in our Head Start classrooms in Lincoln. Children with special or exceptional needs are placed with these older adults to get just some extra one-on-one attention from someone who they may not have a relationship with like that outside of the classroom. So they're really focusing on developing social, emotional skills and school readiness. You know, sometimes people get hung up on the word foster in foster grandparents, kind of might be confusing, but it's very different than what you might think of when you hear the term foster parent. These are grandparents who are placed in classrooms, who are being important role models and creating special bonds with the children to help with their development. They're not living in the homes with the kids. They're in their classrooms.
And these are kids that are under the age of 5?
Yes. So our Head Start and early Head Start classrooms have foster grandparents, and those classrooms are age infants, so age 0 to age 5. So we kind of run the whole spectrum of early childhood development.
So all of the interaction does occur in the classroom, and the foster grandparent does not go to the child's home ever?
Correct. Yep. It's all occurring in the classroom.
What are the qualifications to be a foster grandparent?
So in order to become a foster grandparent, you need to be at least 55 years old. You have to pass some background checks, and you also have to qualify with your income. So what that means is, because we're a partnership with AmeriCorps Seniors, we're required to only have foster grandparents who are at a certain level of income per year. But I will say that if you're worried that you might be over income, to just give me a call and we can talk about it, because there are some exceptions to that. And we could always find a way for you to volunteer, even if it's not in the foster grandparent program, to just see what's a best fit for you.
Do any of your foster grandparents that have been through the training and are involved, can they interact with more than one child?
Yes. So our foster grandparents have students in their classes that they're focusing on. And those might be students who have some exceptional needs or are from more at-risk backgrounds. But the foster grandparents are there for the entire class, and the entire class knows that they are their foster grandparent. They call them grandma or grandpa, and they're interacting with the whole class, working on activities. But they do have some kids that they're really focusing on that may have some extra needs.
The schools that are involved in this, are there specific schools, or is it all over the city?
So we work only with the Head Start schools in Lincoln, which are run through Community Action. So right now we are at 3 different Head Start centers in Lincoln. And yeah, so they're able to work with those kids that we work with at Head Start.
What is the time commitment per week? Is there a certain amount of time you try to keep it confined to?
Yeah, so our foster grandparent volunteers commit to at least 15 hours per week, but some of them go up to 35 hours a week. So it could be kind of more of a full-time commitment, or kind of more of a less full-time, so 15 hours.
I'm sure you get a lot of great positive feedback from the foster grandparents. Can you share some of that with us?
Yeah, definitely. We have had such good interactions in the classroom in the last year because of the pandemic. We've had some foster grandparents who have said, I don't know what I would have done if I didn't have this program, especially during the pandemic, because they were able to do things virtually. So it's really been, there's been so many benefits to our foster grandparents who have participated.
And it sounds like you can always use lots more than what you already have.
We are always looking for more foster grandparents. There's always more kids that need those relationships. So if you're interested, we encourage you to check out our website, which is communityactionatwork.org, or you can give me a call personally if you have any questions. And my number is 402-875-9320. And yeah, I'm happy to answer any questions that you have.
Sam, thank you so much. Sounds like an awesome program, and there's nothing in the world like the smile on the face of a small human being to brighten your day.
That's for sure. Thank you so much.
Thank you, Sam. John, how can listeners get more information about Legacy Terrace or any of the other 3 state-of-the-art legacy communities in Lincoln?
You can call us at 402-436-3000 or check out our website at legacyretirement.com.
Thank you, Kathy. We'll talk again next week. Every Saturday morning, we get together to talk about retirement life on The Aging Adventure. I'm Dale Johnson.